There's no other time in life when you'll care more about pee and poop than you do when you're a parent of a new baby.
Yeah, you'll be paying a lot of attention to how many there are and what color they are and what consistency they are. A lot more than you will in the future.
What concerns are there when it comes to the color of poop? Like, what's normal after a baby's born?
Moms that have been around newborns in the hospital know that, and parents that have been around newborns in the hospital know that meconium, or that black sticky stool that babies have initially, is normal. And eventually, a baby that's, especially one that's breastfed, is going to have yellow, seedy, watery poops. In between black and yellow, you're going to see brown, green, and some variations as it transitions. Babies that are formula fed can have a little thicker or pastier stools than the watery ones that we see with breastfed infants, but they can still have pretty soft and watery ones as well. There's a little more variability.
Are there colors that are concerning?
The colors we are concerned about are the University of Utah colors. So red, it means blood, and so we don't want to see blood in the stool, and that's something that we want to talk to the pediatrician about. Black, after it's transitioned from those initial black ones, is another thing, because broken down blood or digested blood can be black. So we want to check that out if a baby has transitioned to normal looking stools and then has black stools later. So red, black, and then white. So it's very rare, but stools shouldn't be white. It should have color to it. So brown, green, yellow. If it's got zero color, if it's white, then we'd want to talk to your pediatrician as well.
When it comes to the number of stools, is there a number that's concerning? What's normal?
So we expect every baby to poop within that first day, so 24 hours. We want them to have one stool. Sometimes that'll be delayed a little bit, and we have a little wiggle room before we get concerned, but that's the goal that we have.
You want to make sure the track is working,
exactly.
They're getting enough to eat as the days go by.
Same with urination, so we want them to pee once in those first 24 hours with some wiggle room where we might watch. And it's also tough because sometimes the nurses or the parents can miss a wet diaper if it was mixed in with some stool, or if it was just missed for some other reason. Some babies pee right away on the warmer when they've taken over, and that might not get recorded in the computer. But we want to make sure things are working kind of in those first 24 hours. Then things should start to increase as babies starting to get more and more nutrition and more fluid from their feeds. So a general rule of thumb is 1 per day of life. So their first day of life, we want at least 1 stool, at least 1 urination. Day 2, we want about 2. I tend to follow the urination more closely, so that as their kidneys wake up and start working, and as they start getting fluid, they should have 1 for day 1, 2 for day 2, 3 for day 3, 4 for day 4. And after that, babies are going to pee a lot and mostly do 10 or at least 6.
You'll be changing a lot of diapers.
And some babies will pee more than those minimums that we talked about. Some babies on day 3 are going to pee 5 times, and that's fine. But those are kind of the general numbers that we're looking for. Fortunately, there's a lot of good apps that moms can download on their phones that can keep track of this for them, and you can do it on pen and paper if that style suits you better. But it's nice because the pediatrician will ask, how many times are they peeing per day? How many times are they pooping per day? And that can give us a good idea of how things are working and how much food they're getting.
Is this something that you're watching just in the first few days of life, or should you continue to track it as the baby gets older?
It's most useful in those first few days, up to 2 weeks, I think, where we're expecting babies to have lost a little bit of weight and then start to gain a little bit more weight. That can be helpful information. After that, some parents find that it's nice to know, like, oh, did they go to the bathroom yesterday? I don't remember. And they can look on their phone and find out. But we're not going to watch it quite as closely after those first few weeks.